So we're pumped to be chatting with you here today. How's it going?
Doing well, man. How's life treating you?
Life's good.
Good.
Life's good.
Outstanding.
It's just had some probably some of the best blueberries I've ever had. So it's a good day right now.
Dude, blue isn't that's one of those one treats that you can either get the tart one, you're like, "Ooh," or you get that perfect one and it actually changes your day, actually.
Yeah, it's you almost start to feel like that. Like I don't know what it is. There must be something new lately because whenever I eat fruit, I start to feel like a tingling sensation, like right in the top of my cheeks. Um,
Yeah.
Kind of feels good. So,
Hey,
um,
there you
hey,
go.
But yeah, I'm really excited to chat with you here today. Let's dig right in. So
Absolutely.
I want to give you the opportunity first before we get started, just in case there's someone out there listening that hasn't
Hmm.
heard of Nomi before. Let's talk a little bit
Yep.
about Nomi Health. What is it?
Yep. So, Nomi Health is we are actually changing the economics of healthcare in the United States. We have a firm belief that we can reduce the cost of care by doing everything in real time. We have four major business lines. We have a pharmacy management that actually delivers pharmaceuticals to self-insured employees at a reduced cost. In fact, one client we recently signed, we saved them 8% a month just by sourcing in that way. Two, we have a analytics organization which takes data claims analytic uh, data and helps companies find where their spend is going to and how to optimize it. For example, hey, you might need a GLP-1 program, right? Or hey, you're actually seeing a lot of back injuries in your truck driving company, right? And these are things that you can focus on to provide to your employees, which then actually leads to action, which is the last two parts of our organization, which is we're creating a network where it's the same doctor, same care, but reduced costs. And the way we achieve that is by the fourth organization, which is financial services, which is we pay doctors in real time. So I'm sure you know this in the healthcare system in the United States, if you pay a doctor cash, the price is different than the price if you go through insurance companies. And a lot of people don't realize that, but like it could be between 30 and 50% cheaper. And I can give example after example. So what we did is we built banking rails. We have our trust charter out in Nebraska to where a an employee goes to a doctor in the network, which we're trying to get all the doctors, so it doesn't really matter. They come in and they do a transaction of the diagnosis they got. It comes through their EHR system. It hits our adjudication. We adjudicate it within seconds, and then we pay them in near real time. And then that way, they give us the cash price, which is reducing off. So it's interesting. Well, I know we're going to get into it, but it's the whole premise of if we make this market efficient, what you find is you can actually reduce the overall cost of healthcare in the United States.
All right, there's a lot going through my head. A lot of
I,
good thoughts here.
and that's the thing. People get blown away. Like, how could you even do that? How do you even take it? And we're like, well, the problem is it's calcified and calcified all in all the wrong ways. And with my near 30 years of international banking experience, which I could share, I'm used to breaking calcified markets.
So kind of to set the stage. I mean, you already set the stage
Yeah.
with your open remarks, but one of the reasons I was also really excited to have you on here was to dig in because this will kind of lead into some of our other conversation
Yeah.
towards the end of the episode. Um, what happened? What exactly happened with the Change Healthcare hack not so long
Yep.
ago, and why was its impact so far-reaching?
Yep, cool. So first off, I will credentialize myself for your audience so they can go, okay, why should we listen to this guy talk about this topic, right? So just under 3 decades in international banking. I was at Capital One for a decade. I was the chief information officer at Barclay Card International, where we ran 45% of the UK economy on a daily basis, billions of transactions a year. And then I was hired by Goldman Sachs to build Markets by Goldman Sachs, which led to Apple Card. So I am the guy who built the consumer bank inside of Goldman, and I'm the guy who built Apple Card. And the reason I give that back is my background is steeped in banking, payments, real-time transactions, multi-decade work there. Um, the For those folks who are not familiar, Change Healthcare, which is a part of Optum, which is a part of United Healthcare Group, Change Healthcare is akin to the MasterCard Visa rails for $4.5 trillion of medical spend in the United States. We can argue like how much percentage they actually control. They said one number before the hack. They said another number after the hack. That those are evidence facts. But let's just say they ran the majority of the transactions of these payments. The reason why when they got hacked on February 21 this year, it is so important is because it shut down all payments in the medical world in the United States. Because even if you weren't using Change as a provider or as a payer or as an employer, eventually you would route at some point back to them as part of the stage. And literally that day, they shut down all their systems, even laptops, because they did not know what had happened. And they'd been hacked by a foreign actor out of Russia, AlphaCat, which is a well known extension of the Russian intelligence agencies. Those agencies have been targeting U.S. Healthcare entities for over a year. And they shot the golden BB, if people are familiar with that term, right? Where you can kill anybody with a BB if it's the right shot. They got it. They got someone to click on a link, which kicked off ransomware through their ecosystem. The reason I give all that groundwork is because literally that day, all the payments stopped in the United States. And nobody was getting upset about that. And I couldn't understand as a banker. So I was calling some of my banking friends and I said, you realize this $4.5 trillion market froze? And they went, well, I saw something on CNBC or I saw a mention of it, but I didn't think it was that big a deal. Over the intervening weeks, hospitals were filing for bankruptcies, clinics were filing for bankruptcies, providers in states were getting a hold of their representatives saying, I'm not getting paid, I can't pay my staff. And this trickle down effect started taking place. And that was the moment where I said, hey, look, we need to make people aware that this is critical infrastructure in the United States that we don't treat as critical infrastructure. And two, it's a calcified market, and this is part of the problem of why our healthcare costs are $4.5 trillion in the United States, and that's why it's a problem. And by the way, they're still not 100% back. They're getting there. My heart goes out to all the men and women doing the work. I know how stressful it has been for them. I really like support them, but we have to do better because if we address this calcification in the United States, we can free up a market and we can reduce the cost of the care getting to patients.
Now, I love what you're saying right now because whenever someone says something and it makes my mind go like a lot of questions go through my head, right? And this is, just so people know, a lot of these episodes, right? Like I have questions I go off of, but I really try to make it whatever comes up
Mm-hmm.
in the moment too, right? But so going back, like, so how did healthcare payment infrastructure become so reliant though on like a single corporation?
Mm-hmm. Yep.
Um, and let's talk about some of the, I guess, the vulnerability. You mentioned a little bit, right? But some of the
Mm-hmm.
systemic vulnerabilities that this ends up exposing when we are relying on a single corporation.
And when it gets calcified, yeah. So
Yeah.
I love doing this. This is fun because I've been spending a lot of time on Capitol Hill helping policymakers get their heads wrapped around this. I was just at a Money 2020 in Vegas, speaking about this as well
I was
with
there.
my fin. Oh yeah, I was a main
Oh, we
stage.
missed each other.
That's a shame. You could have been up there. You could have seen me up there with Sam Mall and I break because we were the ones who broke it when it all first started happening. And I always like to put. By the way, I love being back with all my banking friends. It was fun. But anyways, um, I always like to ground the size of this market so that people can really truly understand it. And then I always like to talk about the emotional thing, and then we'll talk about the vulnerability of the way the infrastructure exists. So what I had to frame it up for policymakers so they could understand what I'm talking about. In the United States, we talk about military spending. We talk about that consistently and constantly. We spend about $1 trillion a year on military spending. We spend more than number two and number three, which is China and Russia, by 100%. If you add up the top 20, we spend more than all the top 20 combined. That's $1 trillion. Also, recently I heard this data point, which I thought was awesome. We're also going to pay $1 trillion against our interest on our debt this year. And everybody loses their minds over those two data points. What they don't understand is we spend $4.5 trillion in the United States on healthcare in the United States, on its way to $5 trillion by 2025. And we are the least healthiest country on the planet. So we're outspending like our two big data points out there uh, by 100%, but no one focuses on the facts that this calcified market, we spend this much money, and we don't look to optimize it. Now, why do we do that? Then I'll get to your infrastructure question. Why do we do that? Is because we made this an emotional discussion, and I remember this from the 80s. It became an argument of I don't want somebody between me and my doctor, right? And so for some reason that branding has stuck and it has made it a third rail. You're not allowed to touch this, right? Because as soon as you do it, you say, oh, but you're getting between me and my doctor. Now, what's interesting, and I would love to get your take on this, man, is that, and this is what I've told people, the moment a doctor or nurse hits the enter button on the electronic health record system, it is no longer a medical process, it is a payments process. All the EHRs in the United States are just billing invoice machines. They take a diagnosis, they create a bill, and then they send it out. And all Change Healthcare is the rails in which they would then move that money around to make that market. If you accept those arguments, right, then let's talk about the infrastructure and what set it up. The history of Change Healthcare. By the way, this is me not punching down on Change Healthcare. This is just me reporting the facts because I come from banking and I use the corollaries of banking to this. Change Healthcare, back in the 80s, 90s, started buying up other exchanges in the United States because they realized if we bought these other exchanges and we consolidate, we can get some efficiencies and we can control the market. Then what happened is they realized they controlled the market. They made themselves very valuable. And United Healthcare 2 years ago, I believe it was, bought them for $12 billion for the sole reason that every payment transaction flowed through them. 12 billion, 12 billion. Okay. If a bank were to buy another bank for $12 billion, it would go through so many levels of regulatory scrutiny to ensure that the safety and soundness of our financial institution. This purchase went through, the DOJ stepped in to block it to say it was monopolistic, and it was struck down by a federal judge. And in the court filing from the federal judge, there was a paragraph where he actually says, I know this is probably anti competitive, but it's going to be okay. So now you have an entity that runs the majority of the payments getting purchased by the de facto single administrator in the United States. We don't have a single payer in the US, we have a single administrator, that's United Healthcare, who purchased it. And now that sets the stage. I'm sorry for the groundwork, but that sets the stage for something that has not invested in its infrastructure. Again, banks suffer from the same thing. It's a large, complex organization, a lot's going on. They didn't invest. They had running on a lot of old technology. In fact, it was just until recently they removed fax modems from dentists. Fax modems. They still push files around by flat files or CSVs. And why there was security built in, because it was a monolith and it was a monopoly with no policy oversight. They weren't held to the same standards that banks are held to. And that just sets you up for just a single shot into that monolithic calcified organization that brought it down. And because the market is calcified into one single monopoly, there was no outlet for that to flow. In the United States, banks have to prove their sound and safety. Then they have to prove if you were to lose your connection to the Federal Reserves, how would you transfer money? I had to do that every year. And then thirdly, if you lost the bank, how would the rest of the financial system keep running? None of that happens in this space. So we became reliant on a single solution that collapsed. I know that was kind of a long run on monologue, but that is just the immensity of us not recognizing the critical infrastructure and the importance of that single identity in this market.
I want to go back to, I mean, you said this kind of in the beginning, and then it started with also when you were talking about Money 2020, right?
Mm-hmm.
You obviously, you've been in both spaces. You've been in the banking, you've been in healthcare. So there's definitely parallels, right, between
Mm-hmm.
healthcare payments and banking systems. What specific lessons or practices from kind of the financial sector
Mm-hmm. Yep.
does healthcare need to adopt immediately?
So actually, I've been spending a lot of time walking policymakers through this. So in 2012 in the United Kingdom, when I was with Barclays, NatWest, which is a major bank over there, did a mainframe rollout. And when they rolled out the mainframe, they did some checks. The team left. The mainframe melted down, and it punched a hole in the UK economy for a week. But because losing that bank and losing that transactions caused complete chaos. Coming out of that, there was something called the Dear Chairman letters, where the UK government went to all the chairmen and the boards of all the banks and said, every year, your people have to certify that they've done all things of infrastructure investment, risk reviews. They've done all the things that they have to do for the parts of the economy they're responsible for. So every year, I had to sign a document that said the two economic important processes I was responsible for at Barclaycard. I had done all the things of well managed, correct oversight, correct investment, and absolutely cite out all my risk and my controls. That was a beautiful framework that could be ported over here. It's tried and true, been inactive since 2012, and it's very simple. And all it is doing is saying, if you're going to benefit from being this important to the economy, then you also have to be accountable and transparent in how you're doing that. And that framework is perfect come across. And there's details inside of that, but you could imagine the things that what they would ask.
Now, let's talk about the role of senators to
Mm-hmm.
address some of these issues, right? So, what role do you believe the federal government should play
Mm.
when it comes to modernizing healthcare payments?
Yeah. So the first off is accepting, even before I get to the premise of monopolistic market, is to say medical payments, and it's such a large market. This is critical infrastructure in the United States, akin to a dam, a highway system, a power grid, right? I mean, if you think about this market, it is 20% of the GDP of the United States, which makes it 5% of the GDP of the world, right? This is significant, right? And so, where policymakers can absolutely play a role, and they should play a role, is actually ensuring that they're holding leaders accountable. That if you're going to, are you going to participate as part of the critical infrastructure in the United States? Then you're going to be adherent. You're going to be accountable, right? And there's all kinds of examples of things that are out there. And if you notice, I'm not talking regulation, I'm saying policy. Good policy. It's a private public partnership. We do it on power grids, we do it on highway systems, we do it across multiple different things where it's holding the people that are participating in the market accountable, and those leaders in Congress are the ones that actually are providing that oversight for their states and for their constituents to make sure that, yes, they are being accountable. Yes, they are managing it to the best of their abilities. And that is the level of accountability that we need to get to. Because as I talk to lawmakers on the Hill, I have to educate. And some of these people have been on health committees, and I have to educate how this works. This is a complete section of this industry where very few people actually understand the arcane dark arts of how it actually works.
I'd like to shift focus back to Nomi a little bit. To By the way,
Mm-hmm.
awesome. I'm loving this conversation. Like your insights are awesome. I think it's probably I can count on a hand the amount of people right that we've had. Well, you're probably the first. Like that's kind of bridged the gap between like was in banking and then went into healthcare,
Mm-hmm.
the payment side of things. So, um, as you already know, you're one of one, right? You're one
Thank
of
you.
one.
Thank you.
Uh,
Thank you.
it's
Thank you.
so when it comes to Nomi Health, you mentioned kind of
Mm-hmm.
in your initial intro, right, when you were telling us what
Yep.
you did, but you know, a couple of the issues that we've talked here today, like how specifically you're addressing them, and then
Mm-hmm.
how you're doing it differently, as
Yep.
well as maybe you could share any specific innovations or systems your
Mm-hmm.
team's currently working on that you'd love to share.
Yep. Yep. So what's really unique about us is we always talk about moving uh, from data to action, right? So, for example, we talked about our data analytics organization, right? We bring in all the claims data, and typically in this world, the way that it works at large corporations, let's take JPMC, right? The bank JPMC, they would get their benefits data information from a year or year and a half in arrears, right? So the benefits manager would go sit in front of the C-suite and say, "Hey, a year and a half ago, we spent $1 billion in medical claims for our people," and it'd be a stack this big. And the executives like the CFO and the CEO wouldn't get into the details of like, well, is our population aging? So are we seeing more high blood pressure, heart disease, that sort of stuff? Or we're Google, where we have a young population, they're fairly healthy, and they need different support like childcare because they're having babies. And so what we do is we actually give that data to them in near real time, right? As quick as we can get the claims in from the payers, we can actually run it through our innovative platform, and then their benefits people have access to the console and they can measure, hey, for our population that's between the ages of 22 and 32, like what is the largest service that they're getting? And then that way, that informs benefit managers to say, hey, these are the benefits that we should be putting in place. At the same time, it's looking at the cost of those things to say, hey, why is our prices going up 10% every year? This is the only market I've ever seen in my entire life that demand went down during COVID, but the price of it went up 15%. I don't like I've never seen a market do that before. But then they can dig in and say, why is that going up? And then they can move to what we call action. And action is, for example, the pharmaceutical management arm that we have. Hey, we can reduce the cost of the pharmaceuticals that you're having sent to your employees. Two, the network, right? Same doctor, same care, but because our innovation there is our contracts of paying in real time, so we get that cash price into the contracts. So the doctor that you would normally pay through your insurance, they invoice for $2,000, but they don't actually get $2,000. They actually get like $250, right? But your company is paying a large portion of that to the administrator. With us, it's like, no, 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 no. You pay that doctor in real time that cash price. So if you said that service costs $250, they get $250 once we get the invoice, once we do some payment integrity checks and fraud checks, that sort of stuff. And then we pay them in real time through electronic funds transfer. And then the last one is the financial services piece, was I'm talking about the payment side. And there's some innovations on that side as well that we're going to be rolling out in the next year or so. For example, stop loss. Stop loss, you pay premiums every month. One of the things that we're thinking is, because we have a trust, we can do a line of credit. So you're not paying premiums, but you only access that line of credit when stop loss has to kick in. So those are the innovations we're bringing to the table. And to us, we run it all in real time. So instead of the arrears that this industry runs in, we run in real time so that those things could be at the fingertips. Just like when you go buy something with your credit card, it shows up on your account just like that.
I love it. Bo, I want to thank you so much for joining us here today, sharing some thoughts, and look forward to future conversations. But thanks for being a guest.
Thank you, man. Loved it.